So, short lecture on some cognitive challenges. PowerPoint's pretty short too. There's 2 videos uploaded to your Blackboard. One is a Dateline episode on autism. I don't know if anybody watched it. It's only a few weeks old, about the resources available for children with autism, and then once they hit a certain age, those completely go away, so the challenges of that. So that's the full episode of the Dateline, and then the other video is very short. We'll actually pull it up in here, but those are the only 2 videos for this week. Okay, so attention deficit hyperactivity disorder, or ADHD. Does anybody know anyone diagnosed with ADHD? Yes.
Aren't you?
I should be.
Oh, I'm playing, sorry.
I should be, yes. And no, seriously, anybody know anybody?
Yeah. I really do. My brother
Okay.
not here.
So, it is difficulty with inattentiveness, impulsiveness, and hyperactivity. You will see children that fail to pay close attention to things. They have difficulty listening. They're forgetful. They can talk excessively. They're fidgety. And they have difficulty waiting on their turn for things. All of your findings that they have to meet to be diagnosed in categories, they have to have 6 or more findings in the categories to be diagnosed, and this is the wrong page number, but it is in your chapter with ADHD, which is towards the end of your ATI book. So nurses need to use a calm approach, use short, clear explanations, focus on the child's strengths, use positive reinforcement, in school you'll see more testing time allowed, regular breaks. So it's up front. Medications, Ritalin, which increases dopamine and norepinephrine. Dopamine aids in the coordination and movement control and aids in the regulation of the flow of information to different areas of the brain. And norepinephrine increases O2 to the brain to aid in clear and faster thinking. So there's been some issue with questioning the overdiagnosis of ADHD because Ritalin is a highly abused drug that can be sold on the street. So if a parent has a prescription for a child, you want to make sure that they know not to just keep it out in the open so someone can steal it, because they can take it to school and sell it to other kids. So. Sure you all seen episodes or articles about Ritalin being abused or sold for children. You want to make sure that they know not to give it too close to bedtime because it can cause insomnia. So think of why someone would sell it and take it, because they could stay up longer and study and get better grades on their test, right? Don't get any ideas. Strattera is a norepinephrine reuptake inhibitor. You want to monitor for side effects with this one because one of them is suicidal ideations. So if your child gets that, you want to make sure that the parent knows to report that so they can stop the medication. Autism. Anybody know anybody diagnosed with autism? Okay. Common symptoms that you'll see in the boxes here in front of you. Failure to develop social relations, extreme resistance to change in routine. So this can be very difficult, especially if you have a hospitalized child with autism, because it's a different environment, different caregivers. So something you may be able to do is make sure that, you know, if they had a nurse yesterday, they get the same nurse the next day, that consistency in care. Repetitive use of language and impaired ability to initiate or sustain conversation is another big one. This is a complex neurodevelopmental disorder that affects social skills. And it's on a spectrum. Yeah, the autism spectrum disorder. Very good. So not everyone with autism is going to exhibit the same amount of symptoms or the same degree of symptoms. Right? It can be genetic. You may, or a parent may suspect, or a healthcare giver may suspect, if there's a delay in one or more of the following: social interaction, communication, imaginative play, and change. And if they see change in routines are stressful to the child. The nurse wants to set realistic goals, slowly implement new situations, and communicate with the child in an age-appropriate level. You may also see, as an infant, or parents may report that as an infant the child would not cuddle, wouldn't bond with the parent as well or cuddle as an infant. Cognitive impairment. This is any mental deficiency. Risk include infections such as syphilis or rubella, a pre-existing problems such as Down syndrome or Fragile X syndrome, fetal alcohol syndrome, assessment depends on the severity. Approximately 2% of children in the U.S. are cognitively challenged. They're classified as mild, moderate, and severe or profound according to their IQ. An IQ of 70 was chosen as the upper limit of cognitive challenge because most children with IQs below 70 are so limited in their functioning that they require special services. Parents may have a hard time accepting a diagnosis of cognitive impairment, so just work with the family to try to help them access resources and develop a plan of care. Tourettes Syndrome. Does anybody know anybody with Tourette's? Tics? What's the movie called that the person just yells stuff out? Is that Shallow Hal? Y'all seen Shallow Hal?
We're not shallow.
Huh?
We're not that shallow.
Oh, okay. Anyway. Tics are abnormalities of semi-involuntary movement. Do what? Do speak well. Thank you. Thank you. Thank you. And we're talking about tics right now when I'm talking, not Tourette's. It's a dysfunction in the basal ganglia. The rapid, repetitive muscle movements, such as eye blinking, neck jerking, or facial grimacing. Cussing.
So this
is... Well, those are tics. Tourette's can be vocal. Yeah. Sorry. Keeping the two.
I don't have tics on mine. Is it part of the slide or you?
No, it's not on the slide. I'm just talking about.
Okay. Could you go over those manifestations, please?
Yes, eye blinking, neck jerking, and facial grimacing. Rapid repetitive muscle movements. Tourette's is an inherited syndrome of motor and vocal tics. Often you'll see it run in families, so other family members will also have tics or Tourette's syndrome. Repeated use of words or phrases that are out of context. Socially unacceptable words. Repeating someone else's words or repeating their own words over repeating themselves. Some can suppress their tics, but Tourette's syndrome lasts a lifetime, so it's not something that heals. It does respond to neuroleptic agents such as Haldol or ORAP, which is, I don't know if I'm saying that right, but it's O-R-A-P. I'm like Adrian, I just say it how it's spelled. Alright, so we can try to answer this. A 3-year-old is diagnosed as being autistic. What information reported by the parents would support the diagnosis? Only like to play with the siblings. The child did not like to be cuddled or picked up. The child likes to look at books as they are read to him, and the child will only play at the child care center after the parents leave. B. The child did not like to be cuddled. We didn't discuss IQs with ADHD, but we'll see if we can guess it. The parents of the child diagnosed with ADHD are very upset. They say, we have never thought of him as having a low IQ level. The nurse explains to them that it is difficult to have identified this deficit in their own child. The majority of children with ADHD do not have low intelligence. There are counselors to help with with their child's lack of intelligence, and the child will be able to participate in special education classes. B. Has anybody been to the Home of the Innocents in Louisville? Okay. To see someone or as a...
We had a little function when I worked at Passport.
Okay.
It was just a little, I have a cousin that's in the home.
You do? This is a video that...
He was just on Facebook on the Home of the Innocents page.
Really?
Yeah.
It's a commercial.
What does color feel like?
You'll probably need a tissue for this one. Sometimes music helps us come out of our shell, and that is truly the case for a Louisville girl living at Home of the Innocents. A video of her has gone viral with a song that you wouldn't normally think a toddler would fall in love with. Wave 3 News reporter Myra Ansari joins us now. And Myra, we've all watched the video of her. It's really understandable why so many people are clicking on it.
Well, Janelle, the moment you see Natalie Hernandez, it's clear why so many, including her caregivers at Home of the Innocents, have fallen in love with her. At such a young age, she's faced so many challenges, but shows us her true heart and spirit, listening to what has become her favorite song. Home of the Innocents has become home for 2.5-year-old Natalie Hernandez. She's lived here since she was 3 months old. A congenital condition impacts her joints and makes it difficult for her to move her body. She lives within the Kosar Charities Pediatric Convalescence Center, receiving around-the-clock care. She shares a room with a teenager who plays a lot of music. One of the songs that gets a lot of play, Miley Cyrus's Wrecking Ball.
I will always want you.
Natalie has her own version.
I came in like the
Part of that video
video is very calm, you know, in Miley's face, but to look at Natalie's, it's so emotional.
Don't you ever say I just walked away.
Staff at Home of the Innocents made this video on Friday, and within a matter of days, it's already gotten more than 46,000 views. We saw it and had to meet Natalie.
One day it was playing in the room, and she broke out into her gestures and her emotion on her face, and it was just like she was in the music video herself.
Of course, like the perfect rock star, Natalie didn't hesitate to perform for us. Mary Peters is a speech-language pathologist. She says music helps Natalie express herself.
It really does bring out the best in her, and I don't think you can quite hear it as much on the video, but there are times when she will really sing along with her songs.
Natalie speaks both English and Spanish. Her parents and older sister have played a vital role in her development. The fact that Natalie can even sit up is a big deal.
When I see the video, I see us. It's a surprise. Yeah.
Angel and Maria say their little girl, with so much passion, has blossomed thanks to the love and support around her.
I don't have words for explain. She changed my life.
And like a wrecking ball, she's managed to take down the walls around her and touch everyone she meets.
Her enthusiasm for life, she just has so much to share with us, so much joy and happiness. We just love her.
And the fantastic news, because Natalie has made so much progress, she'll be going home soon to live with her family. Sorry. They're planning to send her to preschool at JCPS, and it's very bittersweet for the staff at the Home of the Innocents, understandably, because they've just fallen in love with her, as did I, just meeting her for a few minutes, for a couple hours at the Home of the Innocents. And we do have a video of her performing for us on our website at wave3.com. I cry every time I see it, so I'm sorry, but she's just a doll.
Beautiful.
She is
inside
beautiful.
and out, and she looks like she's got a great future ahead.
She does. She does. A very happy girl.
All right, thanks, Clara.
Thank you.
You'll probably need a tip.
The Home of the Innocents is a pretty neat place if you've never been there. They do give tours to nursing students sometimes if it's something that you're interested in. Pediatrics is something that you're interested in. Let's see. This is
Everyone loves that sound
Tourette's.
fall makes when it catches nothing but net. At GMC, we get that. There's nothing like that kind of